Incontinence is a condition that isn't talked about nearly enough. Many people don't seek treatment due to the embarrassment of having to discuss their condition with someone else. But it's vital that you seek treatment in order for you to maintain the health of your pelvic floor. By the end of this video, you'll have a better idea of what incontinence is and how physical therapy can help you.
My name is Leah Lee. I'm a pelvic floor physical therapist at EW Motion Therapy, and I work with a variety of different patients with various types of pelvic floor dysfunction. So today I'm going to talk about what is pelvic floor dysfunction, what are different types of incontinence, and how physical therapy can help. So what is pelvic floor dysfunction? Pelvic floor dysfunction is an umbrella term that describes many different conditions that one may struggle with if they have issues with their pelvic floor. Your pelvic floor is a basket of muscles that sits within your pelvis. So if they're not working correctly, you could have issues with pain, you could have issues with incontinence, constipation, etc. Pelvic floor dysfunction just describes the many different conditions that could be present in that case. Incontinence is, in this case, urinary incontinence, the involuntary loss of urine for various reasons. So you have a group of pelvic floor muscles that sits within your pelvis. If they're not contracting or relaxing how they should, then you can have issues controlling your bladder. So you might leak. Your brain has to be able to tell these pelvic floor muscles when to work, when to operate optimally in order to control your urine so that you're not peeing on yourself throughout your day. There's three main types of incontinence. There's stress incontinence, there's urge, and there's mixed. So stress incontinence is the involuntary loss of urine when you're doing a physical activity. So you could be jumping, running, you could even be sneezing, coughing, laughing. Studies show that there's 1 in 3 women that suffer from stress incontinence on average. The second type is urge incontinence. Urgency is really the strong, intense urge to urinate. So they might leak as they're trying to make it to the bathroom, but there's that strong urge to go. The third is mixed urinary incontinence, which is the combination of both stress and urge. Some research shows that 25% of younger women, 50% of middle-aged women, and 75% of women over the age of 60 suffer from mixed incontinence. Although incontinence is very common, it's not normal, and this is not something that you should have to live with. So there's many different ways to manage incontinence. Physical therapy is a conservative approach to the treatment of incontinence. And physical therapy can help by, say you have muscles that are too weak and you don't know how to contract them appropriately. Physical therapy can help you identify those muscles and contract them in a way that helps you adequately control and reduce your leakage of urine. Say you have muscles in your pelvic floor that are too tight, and tight muscles really can't relax enough to create an optimal contraction to hold in your urine. So it can help lengthen those muscles in that case, and then build the strength behind it to maintain that contraction. Another issue that could be present is you can't hold that contraction for long enough, so you have poor endurance. And physical therapy can help by increasing your endurance of your pelvic floor so that you can hold your urine in for longer periods of time as necessary. It can also help with the coordination of telling your brain, okay, we have to tell our pelvic floor muscles to contract now. We have to be able to control them on command. And so we have to have that neural control to be able to do that. So physical therapy can help in a variety of different ways. And the goal is to be able to control that pelvic floor contraction when you're doing various activities. And so it's not only going to look like strengthening your pelvic floor, but also strengthening the areas around your pelvic floor as needed. So don't let your bladder own you. Go see a physical therapist and get the help you need so you're not leaking throughout your day, that you can do the activities you love to do. You can go laugh with your friends without fear of leaking or peeing on yourself.
Now you know more about incontinence and how physical therapy can help. If you'd like to try a conservative approach and avoid surgery, physical therapy can be a great solution. To learn more about physical therapy, click the link in our description below to watch our video, What is Physical Therapy? This video explains the different treatment methods employed by physical therapists. If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.